Welcome to the Introduction to Nursing Home Clostridium Difficile Initiative webinar. My name is Jason, and I will be your operator for today's call. At this time, all participants are in a listen-only mode. Later, we will conduct a question-and-answer session. I will now turn the call over to Annette Simon. Annette, you may begin.
Welcome, everyone, to today's webinar that's presented by the Lake Superior Quality Innovative Network. The LSQN is comprised of three organizations: Info in Michigan, Metastar in Wisconsin, and Stratus Health in Minnesota. Our effort is to support CMS priorities for healthcare quality improvement in each of our representative states. The objective for today is to hear from hospitals and nursing homes about the importance of c.diff surveillance and data reporting. Learn about the Nursing Home c.difficile initiative, including benefits and expectations of participation. Understand the process of signing up to participate in this initiative. This is a national initiative, and nursing homes across the country are encouraged to participate. However, this call is specific to homes in Michigan, Minnesota, and Wisconsin. If you are joining us from another state, we welcome you, and we encourage you to reach out to your own QIN or QIO. If for some reason that you need to identify that contact person, you can email Sarah Brinkman at her email address, and she will connect you to the right person so that you can reach out to them. The importance of c.difficile. So why c.diff? Well, basically, CDC, Center for Disease Control and Prevention, did a study in February 2015 and resulted in some powerful results. What we know is that more than 100,000 C. diff infections develop among residents of the U.S. nursing homes each year. 29,000 patients died within 30 days of the initial diagnosis for C. diff. 15,000 was directly attributed to the C. diff infection. 1 out of 3 C. diff are at the age of 65 years or older, and 1 out of 9 are age 65 or older, and they die within the 30 days following the diagnosis. The Office of Inspector General said that 70% of the C. diff infections related to harm were preventable. So currently, right now, CMS only has 200 nursing homes located in 26 states out of 15,600 Medicare-certified homes across the nation. After this major outcome and our efforts to get nursing homes enrolled in the National Health Safety Network, this will drive CMS to get reports from 200 nursing homes, and that's more than 2,300. So this effort is very important. This effort is very powerful. But why reports? Next slide. Quality measurement is the first step towards quality improvement. The Federal Register, July 16, 2015, provided a proposed rule entitled Medicare and Medicaid Programs, Reform of Requirements for Long-Term Care Facilities. This rule proposed to require facilities to have a system for preventing, identifying, reporting, investigating, and controlling infections and communicable diseases. Next, we'll have Emily Nelson from Metastar in Wisconsin to talk about the initiative.
Thank you, Annette. So let's take a few minutes to talk about the goals, benefits, and expectations of this initiative. Next slide, please. The LSQIN aims to assist nursing homes across our network to the establishment of a baseline for nursing home-acquired C. difficile infections. In addition, we would like to assist the participating nursing homes in prevention and reduction efforts for C. diff. Our efforts in assisting you to define, track, and reduce infections may be of value in preparing for the requirements set forth in the July 2015 proposed regulations. Next slide. So expectations. So now that we've talked through the goals, let's talk about the benefits to you as a participant. You will receive education and support with gaining access and submitting data into NHSN, as well as using the available reports within NHSN. Educational opportunities such as those related to antibiotic stewardship, team steps, long-term care communication strategies, and infection prevention and control practices. In addition, you will have access to consultation with LSQIN infection prevention experts. Next slide. And now for the expectations of the project. So these would include support from your senior leadership staff, agreement to publicly disclose participation in this project, identify and enroll at least 2 employees to become registered NHSN users, and submit nursing home acquired C. diff infections beginning in October 2016 through December 2018. And lastly, to participate in educational sessions and engage in peer learning opportunities as you see fit for your home. Next slide. And now we'll have Sarah talk about joining this collaborative.
Thanks, Emily. Emily shared the benefits and expectations of the initiative as they're laid out in the participation agreement, and we'll share the link to those participation agreements with you towards the end of our time together today. But now we want to hear from a few of your peers in healthcare representing both nursing homes and hospitals on why they believe this is an important initiative and why you should consider joining. First up from Michigan, we're joined by Dr. Gaurav Vashishta, Associate Medical Director for IAH Hospital Medicine Services in Michigan. Thanks for joining us, Dr. Vashishta. We ask if you would please share with us from your perspective why nursing homes should consider joining this c.difficile initiative.
Thank you so much for having me. There is enough data out there that kind of lays the case for why this is a problem in the first case. Antibiotic use, overuse, and all other factors that affected hospitals led to the emergence of C. diff, which is now a problem in the long-term care setting and even out in the community. So number one, you have to be able to measure the problem to even figure out if you have a problem and to be able to track the effectiveness of your intervention. So data gathering is key. And initiatives like the one Lake Superior Quality Innovation Network is starting give you the tools required to collect this data. NHSN reporting is going to become mandatory in the near future for long-term care settings, just like it is for hospitals. So collecting this data and building up the infrastructure required to collect this data early on, I think, is key. Number two, when you are part of a group initiative, you can benchmark yourself amongst peers. And number two, there is a huge scope for shared learning, best practice sharing, which is invaluable. So being part of initiatives like this in my past experience personally helped my organization be able to say, you know what, we need to do this better, or there is something out there that somebody else is doing that we could either copy or evolve or adapt, and that helps you gain traction. And number three, the biggest part is the strategies that you gain through initiatives like this one will empower you to approach other problems as well outside of C. diff. So I would highly encourage people to sign on and be a part of this because, as I said, the scope down the road is eventually broader than just C. diff, which is only part of the problem.
Thank you, Shishta. I'm noticing that in the chat there are some comments about issues with audio. Is someone from WebEx able to assist us with that? Is there anyone on the line?
I'm going to go ahead and put the call information back in the chat box. In case you weren't aware, you cannot listen through your computer speakers. You have to call into the telephone number.
Great, thank you. And thanks again, Dr. Vashishta. We appreciate you sharing your perspective on why this is important work. Next up from Wisconsin, we have representatives from 2 nursing homes that have joined the initiative already. First up, we have Anna Elsinger, an infection preventionist and wound care nurse at Dove Healthcare, Wissota Health and Regional Vent Center in Chippewa Falls, Wisconsin. Thanks for joining us, Anna. We'd like to hear your perspective on why your facility joined the initiative and why you think others should consider joining as well.
Yes, thanks for having me. I'm very excited to start this initiative between NHSN and Metastar regarding C. diff. As you've heard, C. diff is becoming more and more of a problem, and I think just being able to pair with Metastar and NHN to improve quality outcomes for our patients is a very good opportunity. Every nursing home tracks a lot of their own infection rate and has its own risk for every type of infection. Our facility in specific, we take a lot of vent patients, a lot of trach patients. We have high risk for c. difficile because of those high-risk patients and the very drug-resistant organisms that we have. And there's other facilities out there who also are at high risk, depending on the type of patients that they take as well. I just feel like this initiative with Metastar and the help with education to nursing homes is a great idea, especially infection preventionists, because a lot of infection preventionists are just starting into the field, and their nursing homes would really benefit from having that education behind it. In addition, as you heard it talk already, NHSN is likely going to be mandated in the next few years for nursing homes, so being able to get on board with this right now and have the support with Metastar and NHSN behind you, I think is really good versus you trying to go through the process all by yourself. So I'm really excited to be able to do this and be able to have a baseline of where other nursing homes are in the state of Wisconsin for their C. diff rate.
Great, thank you, Anna. And just to clarify, Metastar is the Wisconsin representative for the Lake Superior QIN. So for those of you who are attending from Michigan or Minnesota, you may be more familiar with MPRO or Stratus. We are collaborating together on this work. So thank you again, Anna. We appreciate your perspective. Also from Wisconsin, we have Nikki Gold and Terry Shev, both from North Central Healthcare in Wausau. Nikki is the Safety and Risk Manager, and Terry is the Quality Specialist. Thank you both for joining us. We're interested to hear why your facility joined the initiative and why you think that this work is important.
So North Central Healthcare is excited to join this project as we, like the other facilities, you do see a lot of C. difficile, but we don't know the amount of C. difficile. Is that what the benchmark is, or what is the average volume in a nursing home? We a lot of times see many of our patients come in from the hospitals, and then we get this infection with C. difficile, and we are working strongly with our antibiotic stewardship. So one of the things I'm excited to see come from this is how people are resolving it. What are the national benchmarks out there? And even though our target and our goal is to get 0 healthcare-acquired infections, we know that's a hard number to get to. So what's a reasonable target number for our patients and our population? You want to add anything? No. Okay.
Wonderful. Thank you, Mickey and Terry. I'm sorry, was there more?
No.
Okay. I didn't cut you off there. We appreciate you sharing with us. Finally, but last but certainly not least, from Minnesota, we're joined by Cindy Noga, Risk Management Coordinator and RN at Glencoe Regional Health Services. Cindy, you bring a unique perspective of working with NHSN in the hospital setting, but you'll also be working on this initiative with the nursing home. So can you please share with us what your experience has been with NHSN and why you encouraged your nursing home to participate in the initiative?
Yeah, I work at Glencoe Regional Health Center, and we're a 25-bed critical access hospital with a 110-bed attached nursing home. So I oversee the infection prevention in both of the entities, both acute care and in the nursing home. And currently I am submitting data to NHSN for the hospital side, and there's clear benefits from that as far as seeing your data and comparing your data. But I think part of the benefit I see of this particular initiative is when people have to sign up for NHSN, if everyone can do it at the same time, I think it'll be very beneficial to you. It's a little bit overwhelming when you go to sign up for NHSN. It's quite a process to get in. And I think if we have a good support system and it'll be a lot easier. And also when you first start to go submit data, it's pretty specific how you have to put it in, and I think just having the support from each other and the support from the group will be extremely helpful in getting started. I know I really struggled when I started on the hospital side, and I sure would have appreciated a group like this to be able to work with at that time.
Great. Thank you so much, Cindy. We really appreciate that. And thank you to all of our guest speakers. It's very helpful to hear your perspectives on why this work is important. Now we're going to switch gears and jump into some nuts and bolts regarding the initiative. Next slide, please. With regards to the timeline, the initiative has officially begun and will run through December 2018. We are still in the recruitment phase and are hoping that following this webinar, you and your facility will join us in this work. As with all quality improvement efforts, this one will start with measurement. The focus of this first year is reporting data to NHSN in order to establish a national baseline for C. difficile in nursing homes. Over the course of the next 3 months, Lake Superior QIN will host 3 educational webinars to assist participating homes in the onboarding process to NHSN. The content for these webinars will be presented by our partners at the Minnesota Department of Health. After these webinars, nursing homes will be ready to begin C. difficile surveillance in October 2016, which is to say they will be tracking C. difficile infections following national guidelines in order to be able to enter it into NHSN for tracking purposes. Once surveillance begins, Lake Superior QIN will be hosting monthly virtual learning labs to provide support in the reporting process, as well as be available for individualized technical assistance. Next slide, please. Moving forward into years 2 and 3 of the initiative, participating homes will continue to report data into NHSN and receive support as needed in that effort. However, the focus of group learning will move towards quality improvement. Participants will receive education and tools to assist them in interpreting their data in order to make it useful in driving improvement efforts, and will receive training and resources related to team steps, long-term care communication strategies, and antibiotic stewardship principles and practices. While homes will be encouraged to apply these learnings in an effort to reduce C. difficile infections, the skills and knowledge gained will certainly be applicable across quality initiatives. Next slide, please. So now that you've heard about why this initiative is focused on C. difficile, what you'll gain from participation, what will be expected from you, why some of your peers in the field think you should join, and what the timeline entails, we know you're wondering, how do we sign up? Next slide. Each state in the Lake Superior QIN has its own participation agreement. All 3 participation agreements can be found on the Lake Superior QIN website. The address is provided on the screen, and it looks like it's also been shared in the chat box as well. When you reach the screen, you'll see the heading Join the C. difficile Initiative at the top of the page, as shown on the left here. As you scroll down towards the bottom of the screen, you'll see the heading It's Easy to Join. Click on the participation agreement for your state and follow the instructions provided. Note that for Michigan, you'll be directed to a fillable PDF that will need to be sent in. For Minnesota and Wisconsin, you'll be directed to an electronic form that can be submitted online. If you have any questions about the program or difficulties accessing the participation agreement, contact information for each state is provided on that page, as well as on the next slide. Next slide, please. So at this point, we will open things up for questions. Looking back into the chat box, you can certainly feel free to submit them there, and we'll also turn it over to the operator to open up the phone lines.
Thank you. We will now take questions. If you have a question, please press *1 on your touchtone phone. If you wish to remove yourself from the queue, please press the # sign or the # key. If you are using a speakerphone, you may need to pick up the handset first before pressing the numbers. Once again, if you have a question, please press *1 on your touchtone phone. Standing by.
It looks like we did have one question in the chat box from Candy Sheeran. She asks about how much time it actually takes to input the C. difficile data each month at the facility level. So I myself don't have any experience with submitting the data, but I know that we have some folks on the line that do have that experience. I'm wondering if any of our guest presenters, Cindy, if you have any insights that you might want to offer, or others that were speaking previously, if you've submitted data into NHSN, how much time it takes to actually do the data submission monthly.
This is Cindy, and I can just tell you that if you just go to put in the data, if you have no C. diff cases that month, it probably will take you less than 5 minutes to put it in. Each case has to be put in. You put it in as an event, and I'd say each event probably takes 5 minutes or less to put in as well. So there is a little bit of time, but once you learn the screens, it goes a lot quicker. But 5 minutes is probably pushing it per event. That's probably a lot of time. I don't think it would be more than that.
This is Mickey. Cindy. This is Mickey Gould and Terry Chefs. We both agree it takes less than 5 minutes per event, and within NHSN they have worksheets that you can fill out ahead of time. And with those worksheets being filled out, it's really fast.
Great. Thank you, Mickey and Terry. I don't see any other questions in chat. Is there anyone queued up on the phone?
Not at the moment. Once again, if you have a question, please press star 1. And we do have a question coming in from Susan. Your line is open.
Yes, I was wondering on the participation agreement, can you print that off and then have somebody at a corporate level review it, and then do you submit it to you guys via email or fax, or how does that go?
Yeah, so can you tell us which state you're calling from?
Michigan, I'm sorry.
From Michigan. Yeah, so I'll turn it over to Annette to address how to submit the participation agreement from Michigan.
Yes, you can certainly do that. You can print it off and then send to us. Yes.
Okay, great. And from the Minnesota, and I don't mean to speak out of turn for Wisconsin, so Emily, please correct me if I'm wrong. You certainly can print the information or ask for a hard copy version of the participation agreement if you'd like to share it with your leadership. We do ask that you submit it electronically just for tracking purposes for us to get all of them in the same format, but if you're looking for a hard copy to share, we would be happy to provide that as well.
Okay, thank you, and we have no further audio questions at this time.
Great. We did have, looks like we have a couple of questions in the chat box. Christy Nathan has asked, how will joining help my facility? And I'm wondering, Gavin, if we can maybe go back to the slide on benefits. That might be a useful visual while we discuss, I think that's slide 7. One more back. Sorry about that. There we go. So some of the benefits of the initiative include getting that really kind of at the elbow and group learning support related to the onboarding process for NHSN and data submission. And the first year of the program will really focus on that data submission process and following the surveillance guidelines provided by NHSN, which will prepare your facility should reporting become a requirement, which signs are pointing to that will be the case sometime in the near future. And then beyond the first year of the program, we'll begin to look at quality improvement related to specifically c.difficile, but the strategies that we'll be providing and the tools and education will be applicable across the board to various quality-related improvement efforts. So we'll be working on the Teen Steps long-term care communication strategies and techniques, antibiotic stewardship principles and practices, improving inter-facility transfer communication, and other infection prevention, control, and containment practices. Is there anyone else from either Emily or Annette, would you like to add anything in terms of how will the facilities benefit?
At this point, you will receive technical assistance from your LSQIN or your QIOs that will help you because, again, if this is going to be something that is expected of the nursing homes, you will certainly have a good start and a good understanding of how to input that data for your facility.
Great, thanks, Annette. Candy has a kind of specific question regarding reporting in terms of if a resident is entered as an event in 1 month, are they submitted again each month or with each reinfection? And I don't believe it's our intent on this specific call to get into the details of the reporting process. That is certainly something that we would be able to provide home support with if they join the initiative as we get into the reporting process. I don't have the answer to that specific question off the top of my head, but we would certainly be able to provide that support when we get to that point in the program. Renee is asking if we've joined the initiative, we're obligated to submit any new cases of C. diff or any facility-acquired infections. The obligation on the part of participants, maybe Gavin, if we could go to the next slide with expectations. So to join the initiative, you do need to be able to demonstrate support from your senior leadership in the form of signing off on the participation agreement and identify at least 2 employees to be registered with NHSN, and then participate in our training sessions that we'll be offering to get the homes ready to report to NHSN, and then submit C. difficile data monthly starting in October of 2016 through December of 2018. And that is that the process of submitting new cases of C. difficile through NHSN is part of the expectation and obligation. And then beyond that monthly reporting, we'll be participating in the educational sessions that are focused on quality improvement. Renee, I hope that answers your question. Please let me know if you have any further questions about that. We've got someone else asking for slides. I do believe that the slide link has been provided. Jody is wondering where she can find tracking tools on the website, and those are some of the things that we will be providing to homes that do sign up to participate in the initiative. There are tracking tools that are provided on the NHSN website for long-term care facilities, and we'll be walking through what those tools are during the educational webinars that will be provided over the next few months.
And pardon me, speakers, we did have an audio question come in from Chloe. Your line is open.
Are any of the coaching calls or educational videos going to be recorded if we can't attend at a certain time?
That's a great question. Yes. So the first 3 webinars that will be held, one in July, one in August, and one in September to focus on the onboarding process and the initial reporting requirements, those will be recorded and made available to participating nursing homes if they are unable to attend. Of course, we encourage you to participate in the live event, but understand that that's not always possible. As we get forward into the monthly virtual learning labs, we'll be offering at least 3 or 4 times for those learning labs to provide support as homes are reporting their data. So our hope is that you'll be able to make it to at least one of those offerings, and we'll do our best to offer those at different times so that they work with both schedules.
Do you know where those will be located?
The learning labs they'll be virtual, so they'll be a webinar based.
Okay.
Thank you, and we have no further audio questions.
Great, thanks. Jody's asking about, in the chat box, would you report if the patient comes in with C. diff or if they get C. diff when they are admitted? And so part of our learning process will be understanding the surveillance requirements put forth by NHSN, what counts as a reportable event and what does not. And so we'll get more into the details of that as we get the project underway. Pat mentions that SNFs are involved in a number of programs, and the real question is how much time per day, per week, per month is required outside of submitting data. So I can tell you that from our perspective, the onboarding process does take some time. There are some processes that you need to work through. Our goal is to provide you with as much support during that as possible to ensure that it goes as smoothly as it can. Once we get past the onboarding process and you have a couple of staff at your facility who are identified to submit the data to NHSN, during the first year of the program, the focus really is on that data submission. And so the time that it takes to actually submit the data is the requirement at this point. And then going forward beyond that, once you get into kind of a groove with the data submission after the first year, that's when we'll be changing our focus over to quality improvement. So we'll be providing you with education and tools for those quality improvement efforts. And it will really be dependent on your facility what level of effort it will take to drive improvement related to your C. difficile infection rate. Annette or Emily, anything to add to that?
No, I think you covered it.
Okay. And then there was some questions about cost for participants. This is a completely free initiative. This is an opportunity for nursing homes to get hopefully ahead of the curve with regards to these reporting requirements that may be coming down the pike. So we hope that you'll join us in this. And there will be an email sent out from each state to participants who have signed on for the initiative with information for registration for those first three for the onboarding webinar series. So to Robin's question in the chat box, you can expect to hear from your respective state representative. Are there any other questions either on the line or that anyone wants to submit in chat at this point?
As a reminder, if you have a question, please press *1.
Gavin, can we get the link to the page with the participation agreements one last time in the chat box that's readily accessible for folks? We hope you will go ahead and take a look at those participation agreements and that you'll consider joining us. Of course, if you have any questions, feel free to reach out to any of us that are listed there on the screen, and we hope to be working with you soon.
Thank you, ladies and gentlemen. This concludes today's conference. Thank you for participating, and you may now disconnect.